Hi, and welcome to the JayDoc Community Clinic. The Guadalupe Clinic and JayDoc Clinic partner to provide quality health care for people in need. Regardless of income, the clinic is directed and operated by medical students, pharmacy students, pre-med students, and area physicians. Now let's hear from some of the people involved with this clinic. What has it taught you to be here at the clinic?
That's a great question. I think it's taught me a lot of things. The most important thing is you are only as good as the people you surround yourself with. I've been very lucky. The board that I've worked with, especially this year, but in all years during medical school, it's just students who are so smart and so dedicated and really are out there to provide the best care for patients who otherwise wouldn't get excellent care because they're uninsured. So I think you really learn about teamwork, you learn about surrounding yourself with people who are smarter than you are. Everybody's creative, everyone has excellent ideas.
So you have a special place in your heart for JayDoc Clinic?
Yeah, I do. So I am a Mexican immigrant. I was born and raised in Mexico. I volunteered here as a pre-medical student. I saw the great work that JayDoc does, and the community that we serve is a lot of our patients are Spanish speaking, and I knew that when I started medical school that I wanted to be involved in JayDoc, and so now I've kind of continued my volunteering journey with JayDoc. I have loved it.
Muchas gracias.
Thank you.
Being able to go in and actually practice being a doctor, it's a humbling moment. I definitely have a special connection with underrepresented individuals entering healthcare. My family is non-English speaking, and being able to be there for a community that I can relate to on a familial level, it's part of the reason why I want to do medicine.
Now, what about the pharmacy itself? Do you dispense?
At the clinic, we do have a dispensary, so it's limited compared to like a Walmart or CVS. If we do have a medication available here, as pharmacy students and professional students, we actually get to take the medications, write the prescriptions, and even get to check the labels before we dispense the medication, so we kind of get that feel as a pharmacist and as professional students. And I think it's very efficient with the time that we get to spend with the patients here. There's always a pharmacist here with us, a licensed pharmacist, so getting to have their guidance, helping the patients, it's been really nice. And then I get to see them when we go back to school too, because they teach as well. So kind of always having that connections with them. What do you mean by up to 20? What do you think?
I think JayDoc Clinic was one of the best experiences I had as a student.
Now, are you still involved with the clinic?
Yes, and now the exciting thing is I get to be on the other side and get to mentor the students and advise the students. So about every quarter I get to volunteer, sometimes more, and serve as the faculty attending at the clinic. So I get to see the students learn, watch their progression as they go from, young medical student to seasoned medical student, and really get to admire the leadership of the student directors now. My role is pretty minimal as faculty, I think, because the students do such a good job in running the clinic themselves.
I love it. I think it has a wonderful mission statement to provide compassionate care to patients who are in need, who might not have insurance or other resources, and so I think it's a wonderful opportunity for the patients. It's also a great opportunity for students to be able to interact with patients of diverse backgrounds, to see these pathologies, to also feel comfortable going to clinic during their third and fourth year because they've had that experience, that hands-on experience. And I also feel like whenever you are studying, you learn a lot from your patients, and I remember different pathologies because I remember the patient that had them, and so their stories stick with you. So I think it's a wonderful, wonderful clinic for both the patients and the students.
Hi.
There's no textbook patient, everybody's individual, and I think that's definitely one of the best parts of being here.